Taking good care of your health sometimes means having a colposcopy for follow-up of an abnormal screening. Colposcopy allows your healthcare provider to examine the cervix under magnification to assess for any abnormal or precancerous cells and determine whether treatment is needed. Knowing exactly what a colposcopy is and how it's done can help ease fears and prepare you for the procedure. It's a simple procedure that usually takes less than 30 minutes and can be done right in your healthcare provider's office. The colposcopy instrument, colposcope, is like a microscope that shines a light into the vagina and onto the cervix, giving your healthcare provider a closer look at abnormal cells. Abnormal Pap tests are often caused by HPV or human papillomavirus. HPV is a very common, slow-growing virus. It can cause precancer and rarely cancer of the cervix. It is estimated that 80% of people who are sexually active have been exposed to HPV at some point in their life. Exposure to HPV could have happened years ago. Other problems may prompt your healthcare provider to recommend a colposcopy like bleeding during intercourse, lesions on the vulva or vagina, benign growths like polyps. It's comforting to know that risks like bleeding and infection after a colposcopy are rare. Avoid scheduling the colposcopy during heavy menstrual bleeding. This will give your healthcare provider the best view of your cervix. In preparation, take over-the-counter pain medicines an hour before the procedure. On the day of the procedure, you'll be asked to sign a consent form. Consent will not be signed until the day of the procedure. For 48 hours prior to the procedure, please avoid sexual intercourse, inserting tampons, creams, and other vaginal medicines, and douching. During the procedure, you'll lie on the exam table just as you do for a Pap test. The healthcare provider will use a speculum, a medical term for an instrument that holds the vaginal walls open, to see the inside of the vagina and the cervix. A vinegar solution is applied to the cervix to make the abnormal cells easier to see. You may feel pressure or a slight burning for a few moments. Then the colposcope is placed outside the vagina and the cervix magnified. Based on the appearance of the cervix, a cervical biopsy might be done. Your healthcare provider would remove a small sample of tissue and send it to a lab for testing. The lab tests can determine whether or not precancerous cells are present and, if so, what level of abnormality there is. Endocervical sampling might also be done. A small brush or other instrument would be used to take a tissue sample from the cervical canal. You may experience a small cramp or pinch during these procedures, but it is well tolerated by most patients. Medicine may be applied to the biopsy site to stop bleeding. If you're feeling lightheaded or dizzy, continue to rest on the table until you're ready to get dressed. After the procedure, you can go back to your normal routine for the day. If a biopsy was done, you may have mild cramping or light bleeding for a few days. You may also notice a vaginal discharge from the medicine used to stop the bleeding at the biopsy site. This discharge may be different colors, including yellow, brown, or black. Use pads, not tampons, for at least the first 24 hours. If you have any discomfort, over-the-counter pain medicine can be used to provide relief. Call your doctor if you have heavy vaginal bleeding, more than one pad an hour for 2 hours, severe or increasing pelvic pain, a fever over 100.4 degrees Fahrenheit or 38 degrees Celsius, foul smelling or unusual vaginal discharge. Ask your healthcare provider when you can resume sexual intercourse. If a biopsy was done, it may take a week or two to get the lab report. Your healthcare provider will contact you to discuss results and further treatment if needed. Questions are always welcome, and your healthcare provider is the best resource for answers.